and I'll just start with that general introduction before we go into the formal start. So good evening to everybody. We will begin in a moment, as you probably just heard us chatting about. Just to be aware, the meeting is being live streamed to YouTube. So if you don't want to appear on the live screen, and indeed it's been recorded, then by all means, please do turn off your video. And there's you can see how to turn off the video by pressing that stop video sign on your screen. If you could all keep your mic muted unless you're asking a question, that's really helpful with background noise and so on. And if you could want to ask a question, and we do have a dedicated Q&A session at the end of the agenda, then please do raise your hand in the normal way, your electronic hand. We might not be able to see you waving, but we'll try. If you can't find, sometimes the hand buttons aren't always easy to find. We realise that. So if you are waving, we'll get to you if we possibly can. And I will be helped. The team will help me absolutely jump in if I've missed something, team. And if somebody wants to speak, and I've missed it, let me know. Please do also use the chat function if you so desire. So I think with that we should kick off. And should we do the? Should we have the apologies? Julie, who have we got to?
I've received apologies from David Tredrier, Vicky Lyons, Sandra Bell, Martin Claydon from EMAS, and Councillor Matthew Golby.
Okay, thank you very much. And the next slide, please. Just to introduce myself, I'm Will Pope. I'm the Interim Chair of Healthwatch Northamptonshire, and as you'll hear in the presentation later, we're very much looking for a new substantive chair so that I can step out of the way. So we'll deal with that when we get there. Next slide, please. So the annual meetings are interesting things, and welcome to our 2021 annual meeting, when we're going to look back at 2020. There's too many 20s, aren't there, at the moment, but 2020 to 2021 is the year we're looking back at, as it says there, April 20 to March 21. But actually, it's also, I'm absolutely convinced that it's a responsibility of any general meeting to also look forward, because if you part of any organisation's responsibilities is to look forward as to what's coming and what you're going to be doing in the following period. So I'm going to focus on 2021, and then towards the end of the session today, Katie is going to lead us through a description of what we're going to do what we are doing in 21-22. So my job's to reflect on 2021, and it goes without saying, doesn't it, what a difficult year it has been for everybody, whether we're talking about members of the public or key workers, or but also our staff, everybody having to get used to working from home and supporting each other in ways that perhaps they didn't support each other in the past. And maybe there's some benefits and things to learn from that as well. But it's absolutely right that we recognise there's been a challenge for our volunteers this year, or the year in question, the year of a pandemic that's never happened in our lifetime before, has it? So getting used to virtual meetings, not being able to physically visit health and social care premises, not being able to do enter and view and so on, a really difficult year, different ways of working, different amounts of support for different people. So nevertheless, I think it's absolutely true that everybody rose to the COVID-19 challenge. So let's have a look at the highlights. And the next slide, please. And again, First of all, our team. So for those, I'm sure many of you know the names and faces before you, but that was our team during the year in question, with one exception. There was an additional team member who isn't there at the moment because she left, and that's Lauren. And then I heard today that Lauren's coming back, so part-time, so that's great. So Lauren will be in the team pitches hopefully for next year, coming back to handle the comms side of our business, so and the work that Healthwatch does. So that's the team that was working for you, with you, for the public during the year. And the next slide, please. Then what did we do? So some key numbers here. First of all, over 2,674 people were in touch with us about their experiences in health and social care, whether it was a phone call or an email or replying to a survey or a focus group or whatever. And we provided advice and information to a further 239 people directly. And then we know that another 179 visited our online complaints guide. And that was on our new website, which went live in the August of 2020. So some decent sized numbers there. We also joined in the hashtag Northants Together comms campaign, which was to share information about the COVID-19 pandemic. And through the Northants Together, we shared around 2,000 social media posts. And that was directly supporting the campaign and making sure that people had the information available to them that they needed. And actually, we're still helping, particularly, for instance, around vaccination, still helping with that campaign. During the year, we published 8 reports about the improvements that people would like to see in health and social care services. And then within those reports, there were 41 recommendations for improvement. And then during the year, 45 great volunteers, and we've got to be so grateful to you all. Thank you so much, which is, I'm sure, will be a recurring theme throughout this general meeting. 45 volunteers helped us carry out our work. In actual fact, they contributed best part of 500 hours of their time in so doing. And we actually employ 8 staff, as you've seen from the previous screen. Some part-time element there, but that's equivalent to about 6.2 people. Actually, the 500 hours from the 45 volunteers is equivalent, best part of another 14 full-time equivalents. So if you like, something between 2 and 3 times the hours input from volunteers compared to that of the employees. So next slide, please. And just focusing again on our volunteers, obviously they're so valuable, so invaluable to Healthwatch Northamptonshire, populating the Healthwatch Northamptonshire Advisory Board, giving the advice to the team and the organisation that it requires over the strategic direction and the work it should and could be doing, and then populating also the planning group, which is a key part of everything we do, developing the strategy for the board to look at and advise on, delivering the work plan, and populating task and finish groups on specific subjects and so on. But our volunteers actually ensure the delivery of our statutory role and functions, and without their experience and their expertise, and without their time commitment to attend the various boards and committees around the county that we go to, then we'd be much poorer. So, the work of Healthwatch, in my own words, to gather the views of the population and to re-articulate and amplify those views and to put them in the right way, in the right part of the system with stakeholders and so on, so that the impact of those views and experiences of local people is actually made and heard. So we need to be out there listening, and then we need to be amplifying and making the points that people want us to make. So that's the way we will champion the voice of local people of Northamptonshire, and we do that at every opportunity. And as I said earlier, nearly 500 hours, equivalent to about 14 full-time staff helping us do that. We're so grateful. Thank you so much. Next slide, please. Now, there's a lot of words on this slide. I'm not going to read them out to you, but this is, you can read them at your leisure, of course. But working in partnership during the pandemic has been so important. Some of our work we were able to continue. We were able to adapt some of the work we did and do it in a slightly different way. But much of our focus shifted to actually finding out what the needs and experiences of local people during the pandemic, and actually the lockdown part of the pandemic particularly, what those needs and experiences were and are, and sharing those views with health and care partners. And the purpose for doing that, the idea of doing that, is so that we can help partners in the system adapt the services to best meet people's needs. So it's all about championing people's experiences and the needs. And actually this year we had a particular focus around supporting carers, which we'll come on to. So really, from the beginning of the pandemic in April 2020, our first two priorities were to support the public, sharing information about coronavirus, about the impacts of coronavirus, changes to services, and new support, new and old support mechanisms available. And then to seek the views of Northamptonshire residents to safeguard their rights and indeed their health at a time when so much pressure was in the system and so much pressure on people. So for that purpose, we developed a survey. We published it as widely as we could. We obviously couldn't go out and do what we normally do and engage with people face to face in shopping centres and catch people, if you like, on the street or at events to engage with them and get their survey responses. So it had to be an electronically supported survey, but we got 310 responses to that survey. And actually what we found working along with Northamptonshire Carers and Carers Voice Northamptonshire, we really found, I think the biggest impact was that the services during the pandemic had affected those, if you like, informal carers, unpaid carers who are working with supporting families and friends more than any of us had realised. And actually that there'd been a massive increase in the number of unpaid carers during the pandemic. So the findings from this work will be shared, well, when this was written, said will be shared widely. In actual fact, we just, I think it was yesterday, if I'm not mistaken, published that report. So next slide, please. And actually, Gwyn Roberts from Northampton Carers, there's a quote from Gwyn there. It's been a pleasure to work with Healthwatch Northamptonshire and Carers Voice on this insightful report, which has been thoroughly planned and compiled. It provides useful recommendations, which we will seek to deliver ourselves and alongside partners. So a great piece of work.
Gwyn is actually here if you did want to.
Is Gwyn
Gwyn's with us, so he's happy to endorse it in person. If like
Gwyn, I didn't realise you were with us. Let me bring you in if you're willing to say a few words. That would be great.
Yes, of course. Yes, it was a great piece of work. It's now been published, and I think for me it was a deep dive into a very difficult subject, which was carers and the impact of the pandemic. So it was great to have such an in-depth piece of work. And as part of the study, we ran a joint event on like this Zoom, where We had a mixture of carers, some young carers, and also professionals. And actually, I think that's always a useful exercise, actually, when you're getting the professionals from the local authorities and NHS actually hearing the voice of carers, sort of unrefined, as it were, and just some of the data, but also some of the stories. So, carers telling us that that it wasn't just the formal support networks which might have been strained by COVID. So whether it be respite, care agencies coming into the home to give a break, but it was also those softer things that are harder to measure, the informal support networks. So going to visit a friend for a coffee, going out for a walk with friends when they've got that break, was really powerful to hear. So yeah, thank you.
Oh, Gwyn, that's great. Thank you. And sorry to put you on the spot there, but it's great to hear from you. So thank you very much for that
problem.
contribution. Lovely. And then the next example that is cited on this slide is the 15 steps visit. Now, a lot of you will be familiar with the 15 steps process, but together with volunteers from the Maternity Voice Partnership, we actually in June 2020, we conducted a virtual 15 steps visit at Northampton General Hospital and Kettering General Hospital. Now, this was in the midst of the COVID pandemic, and as you'll all be aware, actually you couldn't even go in and visit during that time for obvious reasons that we don't need to go into. But it was decided that the safest way to conduct the 15-step visit was using cameras and to do it virtually. And this, of course, was not only for the safety of staff and patients, but also our volunteers themselves, and also to minimise the pressure that might be that was already massively on the hospitals anyway. We didn't want to add to it. In actual fact, that was the first time that Healthwatch Northamptonshire, or indeed NGH or KGH, had conducted a visit in this way. So the first virtual visit, and lots of learnings in that as well. And it was very insightful, and we saw that both hospitals were coping with new ways of working, and we were able our volunteers and team were able to make some suggestions that both hospitals found helpful. And next slide, please. Now, further work in 2020 and 21, the NHS 111 First Service we've been seeking people's views and experiences of that together and sharing them with the CCG. What we're looking for there is to help facilitate through people's experiences, their understanding of how successful it is or it isn't working, and whether it's meeting the needs of all, especially those with accessibility needs, which of course is very, very important. And then working in partnership with Healthwatch England and the King's Fund and National Voices, we've actually been seeking to understand people's experience specifically of NHS administration. Now, this is very interesting, at least I find this very interesting, because we often focus, don't we, on how important the clinical aspect of work is. And of course it is important. One doesn't want to in any way say that it isn't or suggest that it might not be. But actually, we don't focus, or we haven't hitherto focused as much on the administration side of services. And what we found was that actually this was very, very important. It costs people time and money when it goes wrong. The administration itself, ignoring the clinical aspects here, if it's not done well, can leave people stressed and feeling anxious. And actually it can impact their health as well, maybe delaying diagnosis or treatment or leading to medication errors. So and of course, there's also the psychological impact that poor admin just makes, undermines people's confidence, makes them feel that the system's not working properly, and doesn't help them then manage their care or the people the care of those for whom they're caring. So in actual fact, we were able to show that administration is really, really important. important, and that was very helpful. So next slide, please. And then we've also supported research by Support Northamptonshire, looking at the well-known, and not just a Northamptonshire issue here, but the disproportionate impact of COVID-19 on Black, Asian and minority ethnic communities. So we were able to join the Support Northamptonshire up with those guiding community coronavirus responses and indeed the vaccine comms in the county, and to ensure that the links were optimized and that feedback from those communities could be acted upon. And again, there's a quote there from Nikki Eames-Barton. Working collaboratively and in partnership with other organisations like Northamptonshire Carers and Healthwatch Northamptonshire was invaluable from an engagement perspective, and enable us to inform and forward planning for the COVID-19 response, whilst taking account of the specific needs of different groups of people. So thank you to Support Northamptonshire for that, but another great piece of work. So next slide, please. And then this slide is entitled Helping People Find the Answers. So this year, you'll be aware that we helped people by providing up-to-date advice on COVID-19, both the COVID-19 local response and then the changes to services that had to be made to cope with that. We were able to link people up with reliable and up-to-date information, and then support the vaccine rollout by sharing information. Actually, Northamptonshire has done incredibly well in vaccinations. I've forgotten the exact number now, but well over a million vaccination doses delivered. And we were able to help those struggling to book an appointment as the system developed and matured and people got used to it as well. So helping people access the services they need is, of course, vitally important, and the GP access cards example was a good one. And we were able to help, through that, we were able to help those who struggle to register with a GP because they have no fixed address or ID. And then also just generally keeping people empowered, if you like, letting people know what to do if they needed to complain. And then a Northamptonshire Health and Care Partnership quote there: "Thanks for all your work in getting this resolved. Hopefully vaccination bookings will be much easier for unregistered people now." So again, a positive response. And the next slide, please. So I've got 4 slides now, which just lets you know the top areas, the highest numbers of issues about which people have contacted us. So first of all, the largest number, 31% of the contacts were on dentistry. And the next slide. 23% on hospital care, and the next slide, and 18% on GP services, and that might be a live issue as well with current GP access issues this year. And the final slide, then 3 individual points here: 7% on mental health, 7% on social care, and 6% about COVID-19. So you can see that the 3 big ones there: dentistry, hospital care, and GP services. And I want to thank the team particularly for all the work they've done on that. And I know that Joe has worked really hard, especially on the dentistry challenge, which is a big issue. It's not actually just a Northamptonshire issue either. So it's a regional and a national challenge, but certainly impacting the people of Northamptonshire as well. And the next slide, please. So as I said earlier, during the year, we helped 239 people directly who contacted us directly by phone or email or whatever. And that was actually an 85% increase on the number we signposted for in 2019-20. 179 people actually visited our online complaints guide. And then we also promoted services and information through social media and so on, and we referred forward on safeguarding issues. And the quote there from a member of the public: "I'm very grateful for what you're doing, and I feel like you," the reference there, "I feel like you went the extra step and really made sure to help me out. Thank you very much for your work," which is great feedback. And the next slide, please. So we mustn't let Sheila and Wendy escape tonight's meeting without mentioning the Volunteers Award. So although we have 45 brilliant volunteers who help us understand what's going on out there, what people are thinking, what they think is working, what they think is not working, what improvements they'd like to make, but also we really want to applaud here the work of Sheila White and Wendy Patel, who actually won the Healthwatch England National Award celebrating our volunteer team. So well done to Sheila and Wendy for that. And what they did was a phenomenal 43 trips to inspect 36 wards and departments in Kettering General Hospital. An absolute phenomenal amount of work and a terrific contribution, both for KGH, but also for the people, our population that use KGH. So terrific work, Sheila and Wendy. Well deserved that national award, and thank you very much. And you can see that there's a quote there from Leanne Hatchell from KGH, but Wendy and Sheila provided me with invaluable insights into the experiences of patients and staff at KGH, and that's exactly what we should be doing. So absolutely on the money there, hitting the button. Sheila and Wendy possess a continuous drive, yes, because this is not just a one-off piece of work, and it's not just a one-off time period that they've been doing this in. They possess a continuous drive and a passion for quality improvement, and both have been very active members of a number of our working groups. From their insights and contributions, I have remained grounded and open to hearing about and acting on the right things. I would like to extend my heartfelt thanks and congratulations to them both. So well done, Sheila, and well done, Wendy. Thank you very much. And the next slide, please. So I'm just going to wind up now before I hand on to Esther in a minute or so for Young Healthwatch, just with two more slides. This first one is a summary of the finances of Healthwatch Northamptonshire. And what you can see on the left-hand side is that we had an income of £216,373, which is made up of two parts. The larger pink chunk in the circle there, 195,000 of core funding, which was received from, at the time, of course, Northamptonshire County Council, and 21,373 of additional funding, making a total of 216,000. Just over 216,373. You can see that the expenditure over on the right-hand side was actually £221,170, so just over £5,000 more than the income, and that difference, that shortfall, was actually made up by the Connected Together Community Interest Company, which runs Healthwatch Northamptonshire. So total income 216,000, total expenditure slightly £5,000 more, and the difference made up by the company. And the next slide, please. And final slide from me, just a thank you to all of our 2021 Healthwatch Northamptonshire Advisory Board members. So obviously 2021 going into 21-22 is a year of change, but thank you very much to all our Healthwatch Northamptonshire Advisory Board members for the year in question for 2021, and thanks from us all. And that is me done. I think then if they put up the next slide, yep, Young Healthwatch. I think, Esther, I'm going to hand over to you, and then we'll hopefully, after you, it'll be Katie, and then we'll do questions, if there are any, from attendees today. So Esther, over to you.
Thanks, Will. I am not going to do the presentation myself. I've got some members of Young Healthwatch here who are going to go through it. We have had two that are unable to attend due to COVID. So if it is a bit bitty, it's because it's a last minute change. So apologies in advance. I'm going to do a Chris Whitty, and can I have the next slide, please, Joe? If the Young Healthwatch guys, do you want to all unmute yourselves?
Yeah.
do you want to just introduce yourselves? So we've got Izzy.
Hi, I'm 14 and I joined Healthwatch 4 years ago.
Yeah, and then we've got Daniel.
Yeah, I'm Daniel. I'm 14 as well, and I joined Young Healthwatch 2 months ago.
Yeah, and we've got Daryl as well.
Hello, I'm Daryl. I'm 14. I joined like 2019ish. I don't know.
Yeah. This is the first time we've asked them to present online, so bear with us all, but they are amazing anyway.
Yeah.
So Daniel, do you want to start?
Okay. Young Healthwatch is a group consisting of people from 11 to 24 years old from Northamptonshire. We work to make a difference locally and also see the views of young people.
Next slide, please.
Yeah, sorry, a Word document. Okay. Like everyone else across the country, we were impacted by COVID-19, like the pandemic. But so when we started last year, it was confusing and different, but it's not stopped us from making some amazing work. 2 people in our group wrote letters that reflected on the pandemic and the impact it had. The letters are written to help them process what was going on and help other people understand the issues we had as young people. Yeah. The letter's going to be read, I think. I don't.
Yeah, so Darcy was supposed to read her letter, but I'm going to read it instead.
Oh, okay.
So, say that. Bear me a second. Dear 10-year-old me, currently you're living a happy and free life where you can go out and see your friends, have sleepovers every other weekend. However, in 2020, a global pandemic will hit. Your life will change. School will stop in March and you won't be able to sit your GCSEs. Teachers will make up your grades based on what they think you deserve, but you know that isn't fair. You know that you deserve better as they don't see the work you put in at home. You struggle in exams to focus, so you know there's a chance you'll fail if they want to use mocks to help make up the grades. You won't be able to go out as often, only 30 minutes for exercise per day or essential trips only. You can't see your friends, your family, and your future will be uncertain. The death rates will be so high and many people will die all over the world. You'll have to sanitize and wash your hands constantly. Every Thursday for a set amount of weeks at 8 p.m, you'll clap to show your support for the NHS and key workers. Eventually, the lockdowns will start being lifted. Slowly, normality will return, and by the beginning of August, local lockdowns will take place and another spike in death rates will happen. However, you just have to power through it. You have so many amazing friends to support you, and your family will too. I can't say it's going to be fun, but just think about what the future holds for you from your future self.
Young Healthwatch Northamptonshire reviewed the experiences of young people during quarantine and the COVID-19 pandemic. This includes the impacts of access to health services and how they felt their emotional well-being and mental health was like. 1,173 people between the ages of 11 and 19 had responded to the survey we created. Our findings gave an insight to young people's perspectives and how things have affected them the most. It also sheds light on what they thought of the information and how support was provided to them. This was the first time that Young Healthwatch had created and devised a survey which was published to young people online.
Next slide, please. So in 2020 and 2021, we took a closer look at young people's emotional wellbeing in Daventry. We had a survey that was devised and focus groups that were carried out with secondary schools. We had 473 young people respond to the survey in Daventry, and there were 7 semi-structured interviews as well that were conducted. The reports made recommendations to reflect the findings, and Healthy Young Daventry have responded at the time. The project will go to benefit the young people in Daventry town in the future, and as they look to change local service delivery and design, and they've said that they'll continue to include the voice of children and young people in their work going forward. Next slide, please. So Young Healthwatch have also continued to work with both Northampton General Hospital and Kettering General Hospital during the pandemic, working specifically on certain issues, but again, making sure that children and young people have had a say through the pandemic, and both patient experience leads have joined us online for meetings. Izzy?
We also had input to the paediatric emergency department designs at Northampton General Hospital, which was officially opened by Princess Anne on the 14th of September. She even asked about Healthwatch and what we do.
Next slide, please. So we were able to continue to make sure that children and young people have had a say, and we carried out some community healthcare focus groups as well. These have fed into the wider work of Public Health Northamptonshire and the CCG. Next slide, please. So there is lots of work going on with Young Healthwatch this year. Sorry, other people were supposed to do the slides, so I'm not as prepared as I was supposed to be, guys. Yeah, going forward, there's lots of work continuing with Young Healthwatch, and we continue to feed into the CCG, Public Health, and the ICS locally. Our work is has also been shared with NHS England as well. Next slide, please. I want to say a personal thank you to Young Healthwatch. As many of you know, I am leaving, and I think the work that they have done throughout the pandemic, when they've been asked to do schoolwork, they've adapted and changed so well to everything they have done. And this is the 2nd annual meeting online for them. The work hasn't slowed down. They've continued to be motivated and continue to attend meetings as and when they can, and they haven't let personal circumstances get in the way. We've got some young carers, some with illnesses and disabilities themselves, some that were shielding, and some who are key worker children who were asked to go to school throughout the pandemic. So a wide range of experiences, but in everything they do, they all make me really, really proud. So I just wanted to say a massive, massive thank you to Young Healthwatch for all the volunteering hours you've put in.
Thank you very much, Esther, for that, and that was a really nice thank you, and well deserved as well. And thank you to all our Young Healthwatch contributors, not only for tonight and for your contribution tonight, which is really good, but also for all the work you've done. It just goes to show how important this work is. So thanks very much for that, and let's then move on to our final presentation, which will be from Katie. And this is, as I said at the beginning, this is just making sure we don't forget the importance of and how important it is to look forward, not only to look, we've done the look back now, but also really important that at an annual meeting one looks forward to all the great things that are being delivered and are going to be delivered. So Katie, I'm going to hand over to you.
Thank you, Will. I don't know how I'm going to follow on from Young Healthwatch. I feel kind of set up now. Well done, Young Healthwatch. That was really good. Yeah, if you want to crack on to the next slide, Joe, thanks. So these bullet points briefly outline our new contracts. The new contract was re-awarded to Connected Together, the KIC, who are a community interest company. They're a social enterprise and a partnership between the University of Northampton and Voluntary Impact Northamptonshire. Our new contract will start on Monday, the 1st, and end on the 31st of October 2023. There has been, as you can see, it's still 195k, so there has been no material increase in value. Joe? So along with our new contract comes our new board. The Healthwatch Northamptonshire Advisory Board was also renewed, as well as having a new contract in response to the unitary split, to ensure that our board reflected this. So currently we have Will as our chair, our interim chair. He'll make sure I say that. Our interim chair, he's from the West and has a wealth of experience that I could do another whole presentation on, leadership, expertise in leadership and many senior roles within this industry. We have Marcia, who I've just noted that there's a couple letters missing after her name. She has an MBE and is Deputy Lieutenant. She chairs our planning group, again from the West. Our planning group is our on-the-ground working group and lets us know what's going on in health and social care in case we've missed anything, and help us plan our involvement. You'll see our priorities later, but they're our eyes and ears. We also have new to Healthwatch, Dr. Marcella. She is an academic and our equality, diversity and inclusion champion who has recently looked at the impacts of COVID on ethnic minorities in the UK. Going on to the north, we have Dora. I feel like this is a sporting lineup. We have Dora. She's our voice and champion for carers, those with disabilities, and also works closely with NHFT. Deborah, who is also new to us. Her interests lie with children and young people, including heavy involvement with health visiting teams, and has also many years' experience as a Samaritan. And finally, from the north, we have Sheila. She's been with us since, please correct me if I'm wrong, since 2013. And again, like many of us she has her fingers in a lot of pies. She works mainly across both hospitals and is an elected governor at KGH and represents the governors on the People's Committee, as well as many other groups that I can't reel off the top of my head. So that's our new board. Also, I've just thought we have our Young Healthwatch representative as well, which Darcy is our chair. So she should be on here, but we haven't yet had that conversation with her to let her know that she is a part of our board as our voice for children and young people. Sorry if I'm going too fast. Thanks, Joe. So as I begin this slide, I just want to take a moment to thank you, Will, for taking on this interim role and putting up with us all. But we are still currently looking for a substantive chair. So the opportunity for our new chair is still available online. And this is just a bit of encouragement to say, well, if anybody here is interested, I know there's a few people here, or otherwise, could you please share this where you can? Joe? Or priorities. So each year, our planning group and board together set our priorities for the upcoming year, and we also review our previous year's work and check if there's anything outstanding from the previous year, and so roll it over. We take into account partners and providers' priorities, guidance from Healthwatch England, and more importantly for us, what we hear from the public. Again, as this slide mentions, most of you know there's always so much we could get involved with, and like everyone within this sector, with limited resources, we have to keep this as focused as possible, although we'd like to do everything we can't. This year we'll be focusing on impact of COVID-19 and the continuation of services, access to quality mental health services for everyone, and the development of integrated care, social prescribing, primary care networks, etc. as we work towards this, we've already set up a task and finish group to look at access to GP services, and we will shortly be seeking views from the public on this. This has been, we've seen a massive increase already of the people of public contacting us about access to GP services. So at the minute we are planning our involvement, but also in conversations with the CCG to make sure that this involvement is actually helpful, because we know there's a lot going on. Young Healthwatch also currently conducting a project looking at transitions from youth to adult mental health services, and their input will help to improve those services and be a part of internal training for staff. What else have we started to do? We have Young Healthwatch again has a project looking at their general health and wellbeing, following on from the previous work in Daventry, looking at young people's health and wellbeing. In regards to integrated care, we have volunteers and staff members involved with ICANN, and our support is ongoing there, as there's a lot still being planned that we'll plan that in partnership appropriately. But we're getting going. Yeah, next slide. I think that's it on that one. So I'll probably hand over back to Will, but now if anyone's got any questions on any part of the presentation, I'm sure between the staff, Will, Kate, we can do our best to answer.
That's great, Katie. Thank you very, very much. So yeah, absolutely. Now open for questions, and if there are any, please do raise your hand or pop something in the chat. And I don't see any coming up at the moment. Just while people are thinking, Katie, I was thinking earlier about all the projects that are going on at the moment, whether it's, you know, from 111 to the carers project, which we've just published, to the, you know, the work with Young Healthwatch on transition to adult services and GP access and all that stuff. What most excites you, do you think, about the work that we are doing this year? What really grabs you about that?
I think at the minute the young people's work is really grabbing me, because their input's giving quick actions. So rather than relying on waiting to the end of the year or so many months to see where the impact is, with the work there after each I forgot about another project that they're doing, the transformation project that the young people are also doing, where they are working as the advisory board for the children and young people services. After each meeting there's already an action, so they've already impacted the services and they've already improved it just from having the conversations with the CCG. So I think that does grab me the most at the minute. A lot of the stuff in regards to the adults, I think, takes more time to produce an impact or an action, but it's also worth noting that the planning, especially with the integrated care as well, the time and the GP access, the time we take to plan is really important. So although it doesn't seem like there are a lot of actions, the planning is the action, because if we don't do it appropriately, then the impacts won't be as significant. So we don't just want to do things half-heartedly. I think, especially I can say with the ICANN, the planning and preparation they're really important actions in those meetings. So there's a lot going on, and
there is a lot going on.
Yeah,
no,
it's really, just good to see actions for once, because we could have, as anybody in this sector could say, we've seen the same things for years and years, but this is the first time, and I don't know whether because of COVID really pushing this, that I know there's a lot of negative things and we hear a lot about that. There's also so many positive things that are going on behind closed doors. So yeah, so next year is exciting.
Excellent. Oh, that's really good. Thank you for those comments. And we've got a question. I see a hand raised, and it's Roger. Roger, over to you. And you've got your mic still off at the moment, Roger. So
is that better?
Yeah, that's much better. Got you.
Thank you very much. My question is, as a member of the public who was until recently a Healthwatch board member and somebody who's been an NHS volunteer in a variety of roles since 1978. And it leads on from Katie's point about picking up the issues that remain from the previous year. So my question is, why is the 2021 annual report so partial in failing even to mention the removal in 2020 of its elected chair by the KIC, in the sacking of valuable and respected board members, and I'm told the threatening of others who ask pertinent questions? Despite this, I understand that the KIC has, by West Northampton Council and North Northampton Council unitary authorities, been re-awarded the contract from the 1st of November.
Well, I think, Roger, that is a subject that we probably would have different views over. So you're stating those issues as matters of fact, but some of them also are still being worked through. So I think they're probably, thank you for raising the points. And
I raise the point, Professor, because it is a matter of public interest and of serious concern, because we've heard a lot of good things about what Healthwatch has been doing. But frankly, since just before Christmas, some members of the board have spent a lot of time in trying to engage yourself and other people, including Healthwatch England, with these wider issues. And Healthwatch at the moment is dysfunctional, I'm afraid. And I'm sad to have to say I'm no longer going to waste my time volunteering with it.
Okay, well, thank you for that, Roger. I think the report has shown that Healthwatch is not dysfunctional, and obviously you are entitled to your point of view and your opinion. There would be others who have different views, but I don't think
always,
this is.
Yeah.
Yes, absolutely. But I don't think this is the forum to have an argument over people's different views, especially when issues are, some of those issues are still in debate and unresolved. So thank you for making the point, and you made it very clearly. And your points are noted, I think is what we should say. So thank you. Are there any other questions or comments? Michael Tye, yes, over to you.
Yes, hello. Yeah, my name is Michael Tye, as you can see from the screen. I'm a unitary councillor for Pemberton West in Rushton. I was very keen to join this meeting this evening because I knew very little about Healthwatch, but I have to say I'm quite impressed with the amount of work that they do and why they do it. Had I known about this organisation 5 years ago, when sadly my late wife passed, who was the daughter of a GP in Wellingborough, who received the OBE for his services to health, Dr. Corber, I would have contacted you, because I know it's 5 years later, but I was not entirely happy, sadly, with the way that she died. She had esophageal cancer. So I'm very pleased that I've joined this meeting this evening. I have an awful lot of things on my plate, as individuals would recognise, particularly when they live on their own. And I've realised in the last 5 years how important it is to have a wife or a partner living with you, because I've recognised the amount of work and responsibility that wives or husbands have. So I just want to thank you before I go very shortly, because I'm having a visitor in about 15 minutes time. But I just want to thank you for what I've heard so far. And I do value the contribution that you are all making within Healthwatch. So thank you very much.
Michael, thank you very much. That's a really nice comment to make. Thank you. And actually, your description of your lived experience is really, really valuable as well. So I'm sure you've got a lot of valuable experience there that the team would love to engage with you further on. So I know you said you've got to leave the meeting shortly, but please do be in touch with the team. I'm sure, Katie, you'd be delighted to hear from Michael. Okay, that's fine. That's lovely. Thank you for that information. Thank you very much indeed. Okay. Do I see any more hands raised? I hope I'm not missing anybody who's waved. Oh, John, I think, yeah, I see your hands up. John, over to you.
Yes, thank you, Will. Yes, I think we've alluded to other things which I think need to be discussed elsewhere, and they are continuing. The practical question, I'm not sure whether it's to you, Will, or to the local authorities, but my understanding is that each local authority should have its own health watch. I know that, for example, in Leicester, they're part of 11 different health watches, but they all operate very, very singly. And with this rather unusual thing that's happened in Northamptonshire, we've now got these 2 authorities. And my question is, are we going to move towards two health watches? And looking at the new board, it seems very, very tiny indeed. And I just wondered whether we had sufficient people applying. Is that why it's so small?
So let me try and deal with your points, John. Thank you for them in reverse order. And then I'll also, on your point about the North and West health watches, I'll give my version of the answer, but I'll perhaps then ask Kate to come in and make sure I've given a proper response to that, because I know Kate's been dealing with this actually only today, as it happens, well, including past times, but I know she's been doing work on this today. So on your point about the size of the board, no, it wasn't restricted by the number of applications. What we were looking for was a smaller board in numbers, because you're absolutely right, it was 16, and actually the current standing orders are suggesting that we would limit it to 10 members, and the thought process behind that was to help with agility and so on, and also focus a lot of the strategic and planning design work into the planning group, which, as you know, is much larger. So that's, but what we will do is continuously review. I mean, nothing is ever fixed forever and in tablets of stone, as you know. So we will continuously review the future board size, and if it needs changing, if it up or down, we'll change it. Sorry, John, did you want to come in?
Well, only before. It was 12 members plus up to 4 co-options. Have you done away with the co-options, or are they still available?
No, it's 8 plus 2 now. But you're absolutely right. Yeah, there is still that split. And then on your point about let me say Healthwatch Northamptonshire versus a Healthwatch North Northamptonshire and a Healthwatch West Northamptonshire, you raise a really good point. It's a very good point that you raise. In fact, I speak for myself now, I speak personally, I was initially minded to think that there should be a Healthwatch West Northamptonshire and a Healthwatch North Northamptonshire. But actually the commissioners decided that it should be a Healthwatch Northamptonshire, and that was their desire. Having said that, there is a discussion at the moment going on with Healthwatch England, and Healthwatch England's advice at the moment is that it should be West and North. And funnily enough, we're sort of caught in the middle here. So there's a discussion between Healthwatch England and the commissioners, and this is being worked through at the moment. And I would say it would be resolved in the next week or so. It wouldn't affect the work that's being done, but it would affect the, if you like, the presentation or how that work looks like it's being done. And you cite the Leicester example very appropriately, and you can see from their branding on their website how they do it for Leicester City and Leicester County. So you raise a really good point, which is not yet finally resolved, I believe.
The law seems quite clear. That's why I'm surprised.
No, I agree. The law says you've got to have your own, doesn't it? But they jointly commissioned it. Mind you, they do in Leicestershire as well. But let me go to Kate, because in case I've not given a good enough or proper answer there. Kate, have you got anything to add to that?
No, not really. I think you've covered it all. So I've sent the guidance to the commissioners and I've asked for their opinion on what they think we should be doing. It does mean that if we go to Healthwatch North Northamptonshire and Healthwatch West Northamptonshire, it's quite a lengthy title. We will have to put resources into updating the websites and all our marketing stuff, our social media. There's actually, it seems like a simple thing, we'll just change our name, but actually in reality, it's actually quite time consuming. So I am going to encourage the commissioners to discuss this with Healthwatch England.
Yeah, no, that's a good point. And actually, I think the reality is we'll do what we're told to do because it's not our decision, and they need to resolve it between themselves. We all have our own views, of course, but I think we're probably aligned on our views, but the trouble is they don't matter, if you know what I mean. Okay, thank you for that, John. Any other questions? I'm just conscious of time and it's just gone 7 o'clock, so I'm thinking of people's domestic life here. If there are no other questions, don't see any hands raised. Should we go to the next slide, please, which I think is just to say, well, thank you so much again. Thank you to all our volunteers, Young Healthwatch as well, to our staff, to the people of Northamptonshire who really matter. Of course, we couldn't do any of this without you. So thank you very, very much. Thank you for coming tonight. Thank you to all the people who've supported making tonight and indeed the year gone by happen. We wouldn't be here without all your work. So I'm not going to embarrass anybody by mentioning loads of names, but you know who you are. Thank you so much for everything you've done, and hopefully see you next year. Thank you very much, everybody, and good night.
Thank you, Will.
Thank
you,
you,
everyone.